ask everyone to take their seats, please, so we can do the council meeting. Chair recognizes Mayor Pro Tem Gonzalez.
Thank you, Mayor. Mayor, I'd like to make a motion to take items 42 and 43 up first before the consent agenda.
Second.
Discussion? Favoring opposed, item carries.
Okay, 42 is an ordinance.
Discussion, Councilmember Brown.
Good morning. Thank you, Mayor. Having a sobering center is a great idea for Houston. However, after a week of research, dialogue, and reflection, I realized that this particular proposal is not right for the city of Houston. And my reason is twofold. This project can be better accomplished in the private sector. And just like dropping off sick people in the hospital, liability will not remain with HPD or the city of Houston. Besides, we do not need government to come to the rescue on every issue that faces every citizen. What is next? Housing for rehabilitation, for cancer, after cancer treatment and the like. The second matter is the fiscal matter. The idea to move the lesser criminal populace away from the jails in an effort to lessen our costs is a great idea, but it remains just a good intention, as we will likely increase our costs month after month. The jail is currently operating at bare bones. Whatever currently we're spending on feeding these 20,000 a year individuals, we will likely be spending much more, as the initial cost of $29,000 a month will increase month by month, year by year. We are modeling ourselves after San Antonio, which started out small and now has become like a campus the size of Texas Southern University. This is fiscally irresponsible. We can only expect additions to this program in the future, just like San Antonio. Additions that the taxpayers will suffer with more taxation. This proposal is unsustainable. This will be like a slow cancer that will contribute to the death of the city. This is a great idea that can be handled in the private sector. If a $3 million baseball field can be constructed in Spring Branch with only private sector funds, we as a city can raise $4.3 million to have a sobering center in Houston without burdening the taxpayers. Thank you.
Councilmember Gonzalez.
Thank you, Mayor. Just want to point out first that I totally disagree with my colleague, Councilmember Brown. I believe that this is truly a game changer for the city, and most importantly for the citizens of Houston. More than 15,000 of them that on average per year get arrested for public intoxication. I think that they will be much better served by us removing them from the criminal justice system and the costly system that it is, to a more effective model which better addresses the immediate needs. It's better for the quality of life for the city. It's better for them as well. We do not guarantee outcomes here. There's nothing to say that we're going to rehabilitate anyone, but the chances of removing them from the criminal justice system into a different model is more likely to be much more effective, and likely to save taxpayers millions and millions of dollars over the course of the next few years once this gets established, once this gets up and running. And it's a wonderful use of public-private partnerships as well, where the city isn't tackling this alone, but it's a more holistic approach that better uses resources that are already in the community, and we could potentially leverage private dollars once we do get this established. And so I think that it's a win-win for everyone, no matter how you look at it. Again, it'll be much more cost-effective to deal with these individuals outside of a costly incarceration system. it'll be much more effective in the communities as well. As someone that's been out there on the streets and have arrested people for the on the simple charge of public intoxication, I can tell you that it's much more effective use of police officers' time, especially on a busy Friday and Saturday night when the jails are already full with more hardened criminals that do need to be there. To lessen that processing time by simply being able to drop off at the sobering center. So again, I ask my colleagues to support this. I think that we will see that this will be a more effective model. And most importantly, Houston is in a unique position of being able to marry both the mental health unit and the sobering center as well. I think that will be very effective because they'll be able to better utilize their training and research to better help address these issues as they come forward in a more immediate manner. Thank you.
Councilmember Sullivan.
Mayor and colleagues, I would like to take a little different approach to this. One thing that I talk about a lot up here is going out and doing HPD ride-alongs. And just a few weeks ago, I went to South Central, which is the station that handles the downtown area. And this was night shift, so it was very late. This is when things are kind of at their worst, if you will. And visited with the sergeant on duty that evening and asked him how things were going and how it was to work in this area. And he said that the downtown district covers River Oaks to the bus station. And some of the things that he advocated for are in the sobering center ordinance. And it's a place to take people who don't need to be going to jail. And I have to take that to heart because those are the men and women that are out there working with the public and the very victims that are trying to get off the street. And then after riding with an officer for several hours, he drove me around downtown and showed me all the people that are homeless, drunk, etc. He can pick up almost anyone on the street at any given time and take them to jail, but he doesn't want to do that. He knows that that's not the right thing to do as far as either the city, the jail, or the person, the offender, if you will. That told me one thing. And then riding with the DWI task force 2 Fridays ago, we arrested 2 DWI suspects, took them downtown, and the jail is just absolutely swamped. Officers standing in line to use computer stations. It's busy all the time, so that's another reason. And then third, I'm on the board of a major hospital operator here in the Gulf Coast region, and I visited with the doctors and mental health experts that we have there, and they clearly advocate for something like this to be done as opposed to just throwing people to jail when they're drunk. Thank you.
Councilmember Bradley.
Thank you, Mayor. Good morning. Let me too say that it's fair to say I've done a few ride-alongs with police officers, as well. And I don't disagree totally with everything that Councilmember Brown had to say. As an example, I concur that the engagement is better suited for private sector activity. However, it is an ongoing problem that's been out there for a long, long period of time, and there are no private sector resources or entities stepping forward to deal with the problem. So we have the problem. And folks have gone out and worked real hard and brought to the table what I think is a very viable solution to help deal with the problem. If and when we have a private sector entity that steps up and say they're willing to take this on, then let's see if we can shift it to private sector. But today, we don't have that. So therefore, it is a very plausible option to deal with a very real problem. Our jail is overcrowded, extremely overcrowded. It is under federal decree. It has been for a number of years, and we must do something. There are a number of officers who enjoy doing real police work as opposed to standing around the holding facilities waiting for their prisoner to get processed. This will free officers and allow officers to get back into the field more quickly and provide services to neighborhoods all over Houston or Texas. It is also an opportunity for those people who are inebriated at the time when they are taken into custody to get subsequent treatment that would allow them to deal with their problem from a long-range standpoint. So it's win, 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 win. If none of that satisfies the curiosity as to why we're doing it, for several years the HPD has embarked upon the development of an HPD mental health unit. Lieutenant Stephen Lee and many others, they are specially trained to deal with hundreds of calls that we encounter each year confronting individuals who are suffering from mental health crisis. Some of them long-range crises, some of them temporary. But nonetheless, the officers have to deal with those situations. It is unknown how many officers have not been injured or perhaps killed because of the special training of the mental health unit officers, and how many citizens' lives have been saved because of the special training of these particular officers in this detail. HPD's mental health unit now will have a place to call home, if you will. They've been bounced around with no place to set up the operation and operate efficiently and effectively. So if for no other reason, I'm pleased to support this particular item on the agenda to get HPD Mental Health Unit a permanent place where they can do their work much more efficiently, much more effectively. And the citizens who go through the Sobering Center will be involved in an organization called the Star of Hope. We know what that is. That is an organization that has an exemplary record in our area for helping those in need. So all of that is tied up into one ordinance here. I commend the administration for putting this together. I commend the movement forward of this item, and I would encourage us to support it. Thank you.
Councilmember Christie.
I also will be supporting this project. I agree that the government can't be everything to everybody, but the neatest thing on this council since I've been here is seeing the compassion of this city, and that's in feeding the homeless, or that's finding housing for the homeless. And this is another act, and remember, Star of Hope is basically a private sector group that has tremendous compassion, and they do a great job. And I agree with some of the previous comments that it's a good project. And I've worked in downtown emergency rooms during college and EMS during Army Reserves. And then reminding the council of the story after St. Patrick's Day parade, the inebriated man, the EMS coming in compassionately, taking him to a very costly emergency room. And he wasn't a criminal. And so we've just got to be compassionate with these individuals, and it will save the city money in the long run by not putting them in jail. So I agree with some of the previous comments, and we'll be voting for this item.
Councilmember Marietta.
Thank you, Madam Mayor. This discussion reminds me of a school discussion a few years ago. It's often I'm reminded of school things. They're similar characteristics. We had a school where we had a serious problem with students being tardy. And the administration was pulling out their hair, and so I went in as a sort of an in-house consultant to try to help them figure out what to do. And we looked at socioeconomics with counseling and all these elaborate things. And finally someone said, when are they absent, or when are they tardy? When do we have problems? And they said, well, a lot of times it's when it rains. And so I said, why don't we get them umbrellas? Do the kids walk to school? They go, yeah. I said, let's get them umbrellas. And we did. And their tardy and late and absenteeism really changed. And we needed to deal with some of the other issues. We needed to deal with socioeconomics. We needed to make sure everybody had breakfast. You know, there were a lot of things that needed to be addressed in addition to that. But the first thing we did that was the most practical intervention that made the most difference was a very small thing that you wouldn't think would really, really matter, but it was getting them umbrellas. And I sort of see this the same way. It's an intervention, a first step that I think will make a real difference and allow us to roll out some other opportunities and to do what needs to be done to solve some of the root problems. We don't have a way now to really allow people to connect with the services that they need if they're somehow disconnected already. You know, in many parts of town, you have opportunities to see your doctor, you have all of that. We need the case management and the social services to be able to connect with the clients that need it. And this is a way to allow that opportunity, but it's also an umbrella. And it's just as simple as that. Let's get them in out of the rain. Let's get them sobered up so we don't waste resources that we need to use fighting crime and making sure our citizens are safe and not having their cars jacked or whatever else. And then we need to address the other issues. Thank you, Mayor.
Councilmember Wong.
Thank you, Mayor. I support this item for a couple of reasons. First of all, I believe this is for public safety too. We have so many publicly intoxicated people on the street, and we do not have enough space in jail. And if we are to leave them out there, they are going to endanger themselves, not only to themselves but also to the public. So we have to consider that we have children on the street. I know that Councilmember Helena Brown said some of the points that we have paid attention, but we just cannot kick the can down the road. So not only physically it's going to be conservative and benefits the city, but also the health, the public safety issue here. So I vote for this item, Mayor.
Thank you, Councilmember Parks.
Good morning, Mayor. Sobering Center. Great idea, great philosophy, and good for use. Too many times people are incarcerated and they shouldn't even be in jail. Too many times people are thought of as criminals because they're in the jail system. It shouldn't be. This is good. This is good because we've separated issues, and we have also separated them to the point where we can give aid to problems. And as a pastor and as also a person who has served and goes through my issues I have, when there are no one there for you and you constantly do this, this is a great aid for everyone in this city. Now, to lose this is bad, but to think of it and to do it is great. It's good. Another thing too is we have individuals who are, and we can expand from this. Because why would I want to put someone in jail or prison for being drunk? Well, that's probably going to knock out counsel. Thing is, I said that's probably going to knock out counsel. I didn't say you were drunk. I said, why we want to put people in jail for being drunk? Don't cover your face. This is like, ye who are free of sin, cast the first stone. Now, I didn't come to council to speak politics. I came to council to speak about the people. This sobering center does one thing. It helps people through their problems and issues, and we go to another level. And we find out ways of helping. We have more people who are mentally ill in the city of Houston doing things than we have people who are just not criminally stupid. They just stupid. Now, what I am trying to say is, and I'll put it in a nutshell, help those that need help, we're doing it. Those that don't want help, we have a jail. Help those. This sobering center helps those. And we begin to identify who needs the help, Ellen. So there we are. And I'm for this. And we should have been doing this a long time. And then we need to escalate that to another level of understanding about what we're working with on our mentally ill people who are incarcerated in our city, in our county. Thank you.
Thank you, Councilmember. And just a general comment that in the council chamber, we address each other by our titles.
Thank you, Mayor. You covered your face, so I was like, I lost all decor at that point. I'm sorry.
It's okay, Councilmember Adams.
Thank you, Mayor. I'm really excited